Hi, my name is Jermaine Barkley, and I'm the Senior Health Educator with Health Promotion here at Northern Arizona University. For those that don't know, we're a department that really seeks to optimize student well being through things like advocacy, policy, and education and programs on all kinds of topics concerning well being. So, topics like sexual health, mental health, stress, or as you'll see today, all things substance use and weed. Our goal here really is to provide a full and encompassing look on a topic, not in a judgmental way, but in a way that's going to allow students to make the best decision for themselves as the experts on themselves. So, thanks so much in advance for taking this module, and I sincerely hope you get some benefit out of it. Try to engage with the content as much as possible. Some housekeeping items and words of note: most of the content is presented through videos on YouTube, so make sure your internet connection is solid. Also, if you have any issues actually seeing the content because it's too small, feel free to either open the video in another tab or maximize the video where available. And then also know that you do have to watch the entire duration of the video before proceeding. So let's establish something really important at the beginning. Our goal here is not to endorse cannabis use, nor is it to imply that most students use cannabis. As you'll see throughout the module, that really isn't the case. We'll also be talking about things like harm reduction strategies, but it's really important to note that any level of use when it comes to weed is going to come with some form of risk. There really isn't a way to avoid all risk when it comes to using cannabis and substances. On the inverse of that, though, we want this to be non judgmental and a platform where we can talk about different aspects of weed, its impacts, and outcomes so you can make informed decisions and feel supported. So, today we're going to seek to understand the science behind cannabis. We're going to learn about the way cannabis affects the body and the brain. We're going to try to learn about the relevant laws and policies surrounding cannabis use at NAU in the state and throughout the country. We're going to understand the difference between low, moderate, and high risk cannabis use, learn about different harm reduction strategies, and then lastly, take on key strategies to support our peers or friends that might be struggling with their cannabis use. So, there are all kinds of reasons that folks choose to use cannabis. Some might use it for mental health purposes, some for pain management, maybe through medical marijuana cards, some just for fun and recreation, and some for coping. Uh, but beliefs behind cannabis oftentimes relate to how and how much people use a substance. And so having accurate information is really key. For instance, the belief that weed is a gateway drug might stop a lot of people from ever trying it because they don't want to end up with a severe substance use issue. Maybe it even makes them less trustful of folks who do use cannabis. But we have found in research that weed and cannabis use does not often lead to use of so-called harder substances like methamphetamine and cocaine. On the flip side of that, there might be a notion that you can't overdose from weed, which also isn't true. Someone who might believe that you can't overdose on weed might be more inclined to use it more frequently and in heavier doses. But we'll learn that that can have some pretty adverse effects, including overdose. So, reconciling our knowledge of cannabis and how it impacts us can really help us inform our decisions. And again, that's the goal here, to give you accurate information to inform your decisions on what's best for you. Something else you might have heard is that weed is not addictive. That's not true. About 10% of people who use cannabis form an addiction. That goes up to 15% when it comes to folks who start using before the age of 18. You might have also heard that most college students use weed. That's also not true. Only about 40% of NAU students report having used weed in the last year, with just 33% or one third reporting use within the last 3 months. So it certainly isn't the majority of students.